Hi, my name is Dr. Angela Grace. I'm a PhD registered psychologist out of Calgary, Alberta, Canada, and I have a very special interest in the prevention and treatment of long COVID kids. Welcome to our course, First, Do No Harm. What every educator needs to know about children experiencing chronic illness, post-viral illness, and long COVID. This course is being recorded on Treaty 7 territory with honor, hope, and acknowledgement of the need for truth and reconciliation. Just give me a moment to pull up my slides for you. Okay, here we go. So welcome to our course. We're going to cover a number of modules. Our first module is an overview of what educators need to know about chronic illness, post-viral illness, and long COVID in children. It will be focused on the peanut allergy rule of thumb. We will then be followed with a module of a family's story of long COVID and what students and parents need and want teachers to know. We'll follow that up with important information you need to know and what you may observe in the classroom. We'll have classroom-based accommodations, school-based prevention, and resources. Thank you so much for taking the time to join us in these important modules. So we're going to begin with the peanut allergy rule of thumb. So what the peanut allergy rule of thumb is what our scope as educators is. So when you think about peanut allergies, our scope of practice is that we don't have to know everything. We do need to know how to we do not need to know how to diagnose, and we do not need to know everything about peanut allergies. The same thing with post-viral illness, chronic illness, and long COVID. We do not need to know how to diagnose. That's not our scope of practice. And we do not need to know everything about the illness. We need to know that it exists and what our role is to do. We need to know the basic facts. Who's at risk? It's an invisible allergy. What to do when you observe or the child demonstrates symptoms. And we need to know how to prevent an allergic reaction. The same thing with viral illnesses, especially airborne respiratory illnesses. We need to know the basic facts. We need to know who is at risk because it's an invisible illness. We need to know what to do when we observe or a child demonstrates symptoms. And we need to know how best to prevent airborne illnesses. In both cases, the parents and the child are the best sources of information on how to work with the child, what to do to prevent it, and how to help them when they're experiencing symptoms. So that's the general overview of what you need to know about post-viral illnesses, chronic illness, and long COVID. So the basic facts are this. Children with chronic illnesses, post-viral illnesses, and long COVID do not bounce back or snap out of it. It's not a cold. It is far more serious. They are impacted in every area of their life with functional and cognitive limitations. There is a high risk of complexity and susceptibility to contracting other illnesses because their immune system is now lowered. Parents are extremely worried about their child's well-being when in the care of others, when their child has a chronic illness, a post-viral illness, or long COVID. Parents and children need to be heard and taken very seriously. Some of the basic facts about post-viral illness. There can be new or lingering symptoms after the acute phase is over. They can last weeks, months, or years, even the rest of a child's life. Many viruses can cause severe and chronic post-viral syndromes. There's the Epstein-Barr virus, which causes mono and MS. Influenza can cause Parkinson's. SARS-CoV causes long COVID. And there's also PANS associated with any viral illness. This is a pediatric acute onset neuropsychiatric syndrome, and it is very serious. I'll be talking about that later. Bacteria can also cause severe and chronic syndromes. Lyme disease is associated with ME/CFS. Strep A is associated with PANDAS. Every child is at risk of contracting a viral illness and having long COVID or a post-viral illness. Every single child is at risk. The estimated pediatric post-viral illness numbers in Alberta. So this is from 2021, and the most recent for PANS and PANDAS is 2024. So if we have a population of just over 1 million children under the age of 19, the prevalence is 83 to 373 in 100,000 students of ME/CFS, so myalgic encephalomyelitis, otherwise known as chronic fatigue syndrome. MCAS, which is mast cell activation syndrome, which I'll be talking about later, has up to 17%. So up to 180,000 children have MCAS. PANS and PANDAS, the prevalence is 1 in 200. So up to 5,300 Alberta children have PANS or PANDAS after contracting a post-viral illness. Dysautonomia, we don't have the numbers in Alberta specifically, but there's more than 70 million people worldwide. These are very serious symptoms that impact a child in every area of their life. Invisible illnesses in children are far more prevalent than we realize. So let's look at the basic facts about COVID-19. It is not just a cold. It is an airborne respiratory virus that first goes in through the nose, in through the mouth, and impacts the respiratory tract, then impacts the bloodstream. From there, it is circulated to every organ and system in the body, and we don't know which organs and systems each person is going to be affected by. COVID-19, the virus, crosses the blood-brain barrier and impacts the brain. COVID-19 causes long COVID. Long COVID is a complex, multisystemic, vascular, neuroinflammatory disease. If you look at the graphic on the side, it impacts every single system. And like I said, we don't know which system it's going to impact or how many in a child. There are over 200 symptoms of long COVID. It is an invisible illness. Unless a person has a rash from MCAS, you don't see it on the outside. The symptoms are experienced internally. Symptoms may fluctuate and relapse over time. Every reinfection of COVID-19 virus in its different mutations and variants increases the risk of developing long COVID. Right now, there is no known treatment. There is only symptom management. COVID-19 and long COVID increases the risk of new onset type 2 diabetes, and this is because the COVID virus impacts both the digestive system and it impacts the pancreas. It can cause significant neurological symptoms, including mood, fatigue, sleep, headaches, cognition, PANS, respiratory issues, and exercise intolerance. Overall, it makes children feel extremely, extremely unwell. One researcher noted that long COVID is akin to the damage after a hurricane, and the only way through it is to start to clean up the damage with gradual recovery and rehabilitation. Long COVID and the brain is equivalent to a traumatic brain injury. It can cause long-lasting neurological symptoms. It is strikingly similar to symptoms after a mild traumatic brain injury or a concussion. Symptoms often include dizziness, balance issues, loss of taste and smell, sorry for the typo, cognitive dysfunction, irritability, and headaches. How common is long COVID? A new study published in August of 2024 states that over 400 million people worldwide had long COVID in August last year. Only 7 to 10% of long COVID patients fully recovered after 2 years. That means 90 to 93% of people who have long COVID have not recovered. I have long COVID. I have not fully recovered, and it's been almost 3 years. 2 to 4 million adults are out of work due to long COVID. The economic cost is $1 trillion each year. We do not know the extent of the disability that is caused by long COVID. The estimated prevalence of pediatric long COVID, so long COVID in children, this is not being tracked in Canada. Children are suffering in silence. It's hard to get medical support. It's hard to get educational support. And the very foundation is it's hard for parents to actually be believed that their children are suffering. How can we estimate prevalence? We can use data from other countries, but not all studies use the same definition of long COVID. Prevalence varies on definitions used, the gender, it is more common in females, and age. We know that the prevalence of long COVID increases with the number of reinfections. So far, our pediatric prevalence after infection ranges from 16% to 25.5%. We know that it increases with each reinfection, and there's a higher risk for younger children. But again, every single child, every single person is at risk. So the pediatric long COVID numbers in Alberta, based on these prevalent studies, so 70 to 80% of BC children were infected by August of 2022. Alberta likely has the same number, with 742,000 to 848 Alberta children infected. That's nearly a million. And the prevalence ranges from 14 to 25.24%. That means 100 to 200,000 and higher Alberta children have long COVID. In other words, we are going to have a very sick generation of children, meaning a future of disabled adults if we don't get this under control. Let's take a look at teachers with long COVID. In June 2023, so 1.5 years ago, the current number of Alberta teachers was 35,000. And with adults, there was an 11% risk of long COVID after the first infection, so 2,500 teachers, and a 38% risk of long COVID after the third infection, over 2,600. Almost half of Canadians with long COVID report no improvement over time. We already have teacher shortages. Can we afford to have more teachers in Alberta, in Canada, on reduced work hours, short-term disability, long-term disability, or needing to never work again? How will this impact the future of education? 1 in 4 students at this time is known to have long COVID. We have to talk about the elephant in the room. Most of these children are likely undiagnosed. They may be ill for a very long time. They may be in your classroom. They will not bounce back. We have a responsibility to our children to take the impact of reinfection by COVID and the impact of long COVID very seriously. Thank you for listening. Now you can proceed to the next module, a family's long COVID story, and we'll return later with more information about what you can do as an educator.